So, ischemia and infarct. Ischemia can be caused by cerebral thrombosis, formation of a blood clot in the cerebral arteries, an embolus, a traveling clot, fat, bacteria, or tissue debris that lodges in a vessel occluding it. That is one where AFib plays a role with. An intracerebral hemorrhage, where you do not give clot busting medication because it'll just make the bleeding worse. And according to the chapter, that's where you're going to get an increase in ICP and pressure on a blood vessel, so a tumor. So part of your modifiable risk factors is stop taking drugs, because cocaine not only increases your pressure, it causes vasoconstriction, but you also can have hemorrhage. And if you have cocaine in your body, you can't have surgery because you're going to die on the table most likely. Well, you've got a higher likelihood, according to the surgery nurses. Okay, so the circle of Willis is literally a circle that sits on the bottom of your brain and encompasses. What are you laughing at? Okay, the circle of Willis is a circle that sits at the bottom of your brain and encompasses both hemispheres. So I have to draw this out. I knew I was going to have to draw this out in order to grasp it. Okay. Hang on a second. Hopefully this has ink in it, otherwise that would suck. Okay. Circle of Willis. It sits at the bottom of your brain and it is like a circle, and then it has arteries going off of it on both sides of the brain. So this is right, imaginary line, that's left. So if you have an occlusion on the left side, on that artery that's going out on the left hemisphere, that hemisphere is affected by that occlusion. But since the circle of Willis is a circle, blood flow never stops. It simply goes around. So instead of going down that left artery into the left hemisphere, it just continues going until it gets to the right side, where it oxygenates the right side of the brain and then comes back down and wherever it connects. So because of this occlusion, that's how you got that, regardless of what it is and why the right side of your brain is not affected. But your circle of Willis is also where you're most likely to have an aneurysm as well, just because it's a whole lot of intricate blood vessels right there, and it connects, and it's where your brain usually gets its blood from first. I think that picture helped me. So the reason why a cerebral aneurysm is so bad is because not only does an aneurysm is an abnormal ballooning with it being a thin wall. So you got pressure not only on the vessel, but the structures of the brain that surrounds it, wherever it may be. But once the aneurysm ruptures, it causes massive bleeding, really fast bleeding too. So because of that, and from the previous chapter, it causes pressure on all of that really fast. And because of if it's in the circle of Willis, if the aneurysm ruptures near the circle of Willis, your optic and ophthalmic and your oculomotor, I know for sure, nerves are instantly affected because it's right there. And then the way that this picture looked on figure 24-2 with all the veins, it also looks like it would affect your brainstem pretty fast too. But I'm not positive about that. But it will affect your vision, your hearing, and your smelling. Well, your vision and your smelling. Valve disorders. What drug will every stroke patient go home with after leaving the hospital? Well, does it tell you in signs and symptoms the different, signs and symptoms of various strokes? Because it gives you the diagnostic test for various strokes. Okay, so apparently not. All strokes have the same signs and symptoms. So you're going to have hemiparesis, hemiplegia, you're going to have ataxia, agnosia, apraxia, the blindness stuff, spatial perceptual deficits, which I think that's interesting. But it's not going to specify what the different types of strokes you can have. I think that goes into your assessment. So if you have a patient who is known to have AFib, it's most likely going to be a embolytic stroke. Thrombolytic. What the heck does thrombolytic mean? Cerebral thrombosis, cerebral embolus, cerebral hemorrhage. Figure 24-1. Cerebral thrombosis, formation of blood clot in the cerebral artery. Huh? Huh? I'm confused. Okay. So, a cerebral thrombosis deals with an actual blood clot. Now, where that blood clot comes from is unknown, but it usually is associated with arteriosclerotic plaque, which is somehow different than an cerebral embolus. I mean, the only thing I could see that's different is if it was a thrombosis, you can destroy it with a clot buster, whereas if it's an embolus, it's not going to happen. And then hemorrhage can deal with your most causative factor, I feel like, is going to be your hypertension. Because you got a lot of the ballooning or the arteriovenous malformation. So, you come in with any other stroke-like symptoms. If it's instant, it seems like it's either going to be a hemorrhagic stroke or an embolytic stroke, because according to the book, a thrombosis, either a thrombolytic stroke or cerebral thrombosis, is slow. So if they, doesn't all of a sudden hit them, it proceeds over a couple of hours, that's what it is. So you can have an MRI done, an EEG done, a Doppler done, blood test done for glutamate, and you can also do a lumbar puncture to see if there's blood in the cerebral spinal fluid, because if it's hemorrhagic, it's going to enter your ventricles. Yep, your ventricles, which is where your cerebral spinal fluid is digested and reproduced. That sounds